So an advanced directive is a simple way for you to express what your individual needs and wishes are. And a lot of people are concerned, does that mean that they will stop treating me? Will they not give me the medical care I need? And that's not at all what an advanced directive is. What that is about, it's a form you fill out, and it allows you to designate somebody else to make decisions for you if you're not able to make those decisions for yourself, or if you are able to express exactly what your desires and needs are. You can make changes to that form. If circumstances change, you easily can make a change. Just because you filled out the form one time doesn't mean that that's how it always has to be.
The Utah Advanced Directive has two parts. The first part, very important, covers your selection of a spokesperson. This person should be someone who you've had these discussions with and who will be available and able to speak to the healthcare team when you're not able to do that for yourself. The second part actually articulates your wishes. We all think that we'll be able to speak for ourselves, but in reality, this is not the case. Therefore, having your written wishes available to the healthcare team gives them directions about what you should want and do want for your care to be as you approach the end of your life or as you are gravely ill.
When you fill out an advanced directive, it's important for you to choose an agent who can follow the directions that you set out for them. I see it all the time in practice. The patient has chosen somebody as an agent, such as an oldest child, but when the time comes for making hard decisions, that person is not able to follow through on the directions that their mother or father laid out for them. But the important thing is to choose somebody who can follow the wishes that you set out.
So a lot of people fill the advanced directive forms out as a family. It doesn't have to just be because you're an elderly person or that even that you're undergoing a procedure. A lot of times they fill them out. Even an expectant mother will fill that out so that it's clear how you want things handled during the pregnancy or with the baby.
I feel strongly that everyone over the age of 18 should have an advanced directive. Even if you're not likely to die anytime soon, it's still a good idea. It's just the only way that we have of making sure that our loved ones know what our care should look like if we become very sick.
I can tell you personally the peace of mind that you have when you fill out these advanced directive forms. My father and mother are aging. We had the opportunity to sit down with all of our siblings with them and express exactly how they felt. We filled out the forms, and a few months later when my father had a cardiac arrest, we knew exactly what his wishes and desires were, so we were able to honor those wishes for him.
None of us know what our futures will bring, but by having conversations about advanced care planning, writing them down, recording them, and giving them to our physicians will allow us to face our futures with a great deal of confidence and clarity.
I'm frequently called to a scene in which a decision has to be made by a family in regards to their loved one. Should they move forward with a respirator, or should they disconnect the respirator? It's a terrible struggle for a family to have to make that kind of decision. What I always like to do when I'm called to the scene, I say, I don't know your mom, I don't know your dad, I don't know your grandmother, I don't know your grandfather, but you do. You are the ones who are really qualified to make this decision. They are the ones who have given you the direction that you should follow. Would they want to have their life extended by a respirator? Would they want to live in this manner? The decision is not yours, it's their decision that has hopefully already been made.
So where do you get an advanced directive? Very simple to do. You can get it online, or you can come into the hospital and we can give it to you. What types of questions do they ask on that form? Some very simple demographic questions, as well as they'll ask questions of who do you want to make those decisions for you, potentially on are you an organ donor or not, do you want to be on life support. So some very straightforward and simple questions. The advantage of having those questions answered is then the doctor knows exactly how to provide that care for you. An advanced directive is very important for you to fill out now, a time when you're not in an emergent situation, so that you're the one directing the care you're receiving. You take control. You make sure we understand what you want.
National studies continue to tell us the value and the importance of the advanced care planning process. We worry about things like this, our families worry about it, It's a wonderful thing to complete the process, have our wishes and thoughts recorded and available should we, when we get into trouble down the line. This is a good thing to do for us as individuals and for our families and loved ones. Thank you for your consideration.